Hi, I'm Dr. Stazan Sina. Adolescence can be a very exciting time, mostly for your teen. Often, parents are worried and confused about what their teens are up to. So in this video, what I hope to do is go over a couple of things that I think it's important for a parent to be able to differentiate in order to make decisions about whether or not your teen's behavior is typical or potentially something more problematic. So first, let's go over the notion of privacy versus secrecy. Privacy implies a time to take time for oneself, to relax, to regroup, to set a reasonable boundary. In other words, it's a time for growth, and it's a healthy thing to do. Secrecy, on the other hand, doesn't quite have the same connotations. Secrecy often implies that they're developing some sort of plan. They're trying to hide something that's probably not good for them, that if you knew about otherwise, you would intervene because you may be worried about something bad happening. So as a parent, you need to develop the skill of being able to differentiate when your teen is simply being private or when they're being more secretive and potentially devising some sort of plan to do something that may be more of a concern to you. Increased irritability and anger. Increased irritability and anger is normal to see in a teen. These mood fluctuations come and go. However, what is more problematic is physical, verbal aggression, or outright hostility. In this case, a parent is going to want to come up with a planful, more immediate response to these more egregious behaviors so that you can corral these behaviors and affect some change and hopefully avoid a problem down the road. Transient mood fluctuations. As I mentioned a little bit ago, mood fluctuations are typical and normal for a teen as they grapple with issues, as they adjust to changes in their bodies, such as hormonal changes. However, a parent will want to monitor for more extreme changes in moods, things that may be more indicative of depression or be more indicative of some sort of anger problem or issue with controlling rage. Also, a parent is going to want to note whether these behaviors are transient, in other words, come and go, or they're more persistent and tend to stick around a little longer. Changes in appearance. Teens always experiment with changes in appearance, whether it's hair color, hairstyle, clothing style. This is when you might get more requests about body piercings, and you'll have to have a decision and a response to that, obviously. However, there's a difference between experimenting with changes in appearance and obsessing on one's appearance. In other words, being preoccupied with one's appearance or engaging in extreme behaviors in the result of their own perceptions of their appearance. For example, severe changes in eating habits. Those things are often more concerning and would be a time for a parent to consult with a professional. Some social and family withdrawal. Some social and family withdrawal is normal, and this relates to my point earlier about wanting some privacy. However, there's a difference between some social and family withdrawal and isolation. Isolation implies just wanting to be alone and probably not tending to typical, normal, and expected things that a teenager would do, such as seeing their friends, coming down to dinner, or possibly not even wanting to go to school. These more isolative behaviors could be a sign of something more problematic and would need to be further assessed. Wanting to meet new people. Wanting to meet new people is great for anyone. A teen is all about interpersonal relationships. Wanting to meet new people is a good thing. However, a parent would probably want to store in their back of their head complete shifts in peer groups. And although that may not be a sign of something more sinister or worrisome, a complete shift in peer groups may be one piece of a puzzle that helps a parent to have a better handle on something that may be going on with their peer. So to be aware of complete shifts in peer groups is something that's important. Self-focus. Teens are all about themselves. They love to talk about themselves. They believe that they have unique experiences that no one else has, and no one else can tell them any differently. However, there's a difference between someone who's self-focused and someone who has a blatant disregard for others' feelings and needs, and may exhibit a somewhat of a callousness towards others, not showing much empathy. If this is the case, it may be time to talk with someone, or maybe to talk with some other parents that you can rely on to get further information. During this time, you're going to see an increased curiosity in your teen with issues of drugs, alcohol, and sex. Now, increased curiosity is typical and expected. And even though it's typical and expected, it also deserves a response, depending upon your beliefs and values in your families. That may take the form of simply sitting down and talking with your team, or it may take some more structuring around behaviors and expectations. However, there's a difference between typical and expected curiosity and more extreme behaviors, such as sexual promiscuity, drug abuse. And a parent is going to have to educate themselves either through talking to a professional, reading some things, or talking to other parents about what their teen may be up to with their friends. Because usually teens aren't engaging in these behaviors in isolation. Usually they're engaging in these behaviors with their peers, and their peers' parents are good sources of information. Challenging expectations and values. Challenging expectations and values is also typical. It goes along with becoming an individual, becoming autonomous, and experimenting with independence. However, challenging expectations and values is not the same as outright breaking of the law or defying one's parents. These are more extreme behaviors and are probably going to need a more planful and immediate response so that they don't develop into something more problematic down the road as well. Vying for control. That is, wrestling for control. Again, this goes along with struggling for independence, your teen struggling for independence, and you struggling with letting them become more independent. So vying for control is normal. However, there's a difference between vying for control and blatantly disregarding the rules. In other words, your teen is not even willing to negotiate. Although blatantly disregarding your parents' rules isn't the same as breaking the law, one might lead to the other if a response is not given to such behavior. Shows responsibility. So, you can trust your teen when they begin to show responsibility and accept responsibility for their actions. So a teen who's showing growth and is becoming more independent is going to make mistakes, but they're going to take responsibility for those actions, as opposed to making mistakes and blaming others for their actions. If they were able to accept responsibility, that should instill greater trust in you and should afford them greater leeway in some choices for themselves. Lastly, a teen is going to want to be more independent of parents. However, they shouldn't want to leave the family and have nothing to do with the family. If your teen is showing signs of being more blatantly disinterested or having great disregard for the family, or even perhaps make statements about no longer wanting to be part of the family, wanting to live somewhere else, older teens may throw out the term emancipation, then that's usually a sign of a greater problem. And a parent will need to, again, have a response to that that can address probably what is an underlying issue there. So in the course of this 8 or 9 minutes, what I've done is make a list of some things that would be helpful for a parent to be able to differentiate. And it's important to be able to differentiate between typical behaviors and more problematic behaviors. not only in order to prevent something greater down the road, but it's a good time for a parent to assess their ability to have a response to their teens on their own versus needing to involve a professional. I hope it was helpful, and I hope you join me for future videos. Thank you.